Hey, this is Different Careers with Kate Nudd. Again, I am a licensed massage therapist right now. I am reviewing another continuing education course that I went through. This course is 1 hour C hours or continuing education hour. That's what it's worth. I started it on March 25, ended in March 26. It took me a little over an hour and a half to complete this course. So let's do the introduction. So again, 1 hour. Ruth Werner was the one that did it. She does give a course handout, and she does list some resources. So let's see, let's go to the end. So here is a list of all her resources of where she got some of her information. And I did look up some of the resources up on my spare time before starting the class, and I was reading through them. So this is basically course outline is it goes over blood clot definitions, DVT, thrombi, emboli, whatever, pathophysiology of arterial and venous clots, conventional treatment options, what the research says, blood clot, and question and answer. And I did take the quiz afterwards. Okay, so learning objectives. Having viewed the online massage therapy CE course, participants will be able to define arterial and venous thrombosis, list complications related to blood clots, describe conventional treatment plans for blood clot risk, describe the process to make informed clinical decisions about safe practice and clients at risk for blood clots. So instructors, Ruth Werner is an award-winning educator, writer, and retired massage therapist with a passionate interest in massage therapy research and the role of bodywork for people who struggle with health. Her groundbreaking textbook, A Massage Therapist's Guide to Pathology, is now in its 7th edition and is published by Books of Discovery. Werner is a columnist for Massage and Bodywork magazine and Massage New Zealand. She teaches continuing education workshops all over the world and hosts the I Have a Client Who broadcasts on the APMP podcast network. Reach her at ruthwerner.com. Learn more from Ruth Werner through ABMP Pocket Pathology, quick reference app with key information on nearly 200 common pathologies. So that's probably the updated version of all the pathologies and stuff like that. So I will not go through the whole class, but let me pull this up. Okay, so definitions. Embolus is any traveling debris. That's what she described it as. It can be an air bubble, a bone chip, or anything that moves. Anything in the cardiovascular system that is going to cause a problem where cardiovascular system gets blocked. Thrombosis is a large clot, so it's not moving. It's actual. It's an actual blood clot. So here you can see the difference. This what I've learned from anatomy and physiology in the past is a plaque builds up, it gets stuck, it can't move, and then this is the one where it's a build up as a clot and it can move through the body. Now she went on to say that platelets are our friends. So they are smooth while scanning and spiky when activated. Another name for platelets is thrombocytes. These are clotting mechanisms. The problem is when this gets to be overactive, that's when it forms some kind of blood clot. So, and when it gets into the capillaries, it does slow down. So, she went into describing, the lungs. So the systematic circuit is blood moves from the heart and goes to the rest of the body and back to the heart. And then the pulmonary circuit is the blood goes to the lungs, then back to the heart. So I guess that's important to know, because you can develop different blood clots in the different systems, so they have different names for both. But maybe I should try to move this a little bit and see if I get... Okay, I need a lung picture. So, yeah. So here's the lung picture that she drew. And so it's like, so she was describing the left ventricle takes blood and it goes to all the different areas of the body. And then it goes back up to the right ventricle, and then the blood goes into the lungs and then back to the heart. So the red section is the oxygenated blood, and then it becomes unoxygenated, where there's not oxygen in the blood, and then it needs oxygen again, and so it goes back into the lungs. And that's like the whole system. And she was saying the most common blood clots happen actually in the leg, but it can happen in other areas of the body. So, how does this relate to massage? So, when she was talking through her video, she was coming from a perspective where, like, she was talking about mainstream medicine, where this is information about diseases that you would learn from MD doctors or medical doctors, where they're going to prescribe surgery or some kind of medication or an anti-clotting blood thinner medication to make it so, like, you don't have blood clot problems in the future. And so she was she was showing how, like she has the perspective of a massage therapist with mainstream medicine, that you can still massage other people, but there are risks involved. So you have to take in consideration all the risks. And then she, like, the main thing that I got from the solution to the problem is, if you are a client and you've had some kind of blood clot, you really should have your massage therapist talk to the doctor. And because the doctor doesn't know what different types of massages that the massage therapist does. And so you really need to have the massage therapist and the doctor that's prescribing your medication talk to each other, at least on the phone, and so that way you can get a doctor's note for a massage, but the doctor can be very specific and be like, only work these areas of the body, or only get these type of massage modalities. So that way you are protected. Because if she was saying the medical doctors they're not responsible for knowing what every single individual licensed massage therapist does for a massage modality in the practice. So if a massage therapist doesn't explain what type of massages they do, like, the doctor can't give a good doctor's note to save you from injury, because there is scientific research where they say massage broke up a blood clot and it went into different areas of the body, and it caused the person to die while they were on the table, or like after they went home, but they blamed it on the massage therapist. So what did I get out of this class is that if you're going by medical doctor mainstream medicine, where surgeries and pharmaceuticals are your way of healing your body, there isn't really a solution to get to the root issue of the problem of why you could possibly be developing blood clots in the first place. Another thing she did, I forgot to mention that she did go over in her presentation, is that your body produces chemicals. So that break down the blood clots, or melt the blood clots, is the way she put it. So you have the platelets that build up, like create blood clots in your body, and then you have chemicals that break the blood clots down. And so, because your body's always trying to maintain homeostasis. So she didn't go over this in the video, but what came to mind is Queen Victoria in Europe, where cousins kept marrying each other, and they developed a deformity in the blood for the males, where the males did not have the ability to form blood clots at all, for the most part, and if they got cut too deeply or too much, they could bleed to death. And that's because they could not produce platelets the right way, or whatever. They could not form blood clots to stop the bleeding. So you do need some blood clots in your system to stop the bleeding. But again, she was saying if your body starts overproducing blood clots, then your blood can become too thick, where like blood isn't going to the whole to all the different areas of the body, and even back to the lungs, and then like your system gives out and it dies. So but she was saying they're not allowed to do extensive studies, because they said, like she was mentioning, why can't you do like a research study to actually see if massage actually helps reduce blood clots or whatever. And she was saying after surgeries, if like someone gets a massage right away, it does help reduce blood clots. But like she wasn't concrete of this helps people like days after the surgery. So like I was kind of left in a confused state. So okay, so now we're gonna move on to holistic medicine. So bear with me. Please research this for yourself, but I have listened to some presentations by naturopathic doctors. And naturopathic doctors have medical doctors, mainstream medicine, they separate all the different systems of the body. And so it's like so their goal is, let's just treat the cardiovascular system. Let's just treat the lymphatic system. Let's just treat the skin system of the body. Let's just treat the muscular system of the body. Let's treat the skeletal system of the body. So they separate all the different systems of the body and they treat one at a time. In holistic medicine, the objective is to treat all the systems of the body together, understand how they work together, how you understand how they need each other, how they help each other out. And so your objective is, what are the nutrients that you need in your body on a cellular level that's going to help the body heal itself. So mainstream medicine is, what pharmaceuticals do you need to treat the symptoms? What surgery do you need? That's what they do. Holistic medicine is, what can we do to help the body heal itself? So if you're looking at things of like, hey, I can eat whatever I want, I can do whatever I want, I don't have to exercise. But she sounded like in this video, people could still exercise and still develop a blood clot at some point in their life. So if you use common sense, reason, and logic, and you look into the what naturopathic doctors have found works to help different diseases that people develop, like, that would be my suggestion if you want real health and real health solutions to get to the root issue of why you develop blood clots in the first place. But from my understanding, if you put everything into context, I have listened to naturopathic doctors, and one naturopathic doctor kind of, like, the understanding that I have is, like, the phrase of someone could have a compromised immune system has come up. I think that was like also a general microbiology class that I took at a community college. So yes, people can develop a compromised immune system. Well, why does your immune system become compromised? Well, because on a cellular level, you aren't getting the proper nutrients to give the cells all that they need to maintain homeostasis correctly. So the objective is, your body wants to get rid of all the problems that could cause some kind of disease in your body. So the cells build and they break down stuff. They go through this build, break down, build, break down, build, break down. It's like they have simple tasks that they do, but different cells do different things. So my understanding is, from naturopathic doctors, they've always talked about how if you do something to help your body bring a fresh supply of blood to the area, it actually helps heal wounds, and it can help bring down inflammation in the body. Well, what am I trying to say? Yeah, inflammation in the body. So from my understanding from holistic medicine, if you use reason, common sense, and logic, is, why do people develop severe blood clots where their body can no longer break down the clots? So, for instance, let's go back to the diagram. Okay, so blood's coming down from the heart and it goes into the body. So say there's like some blood clot somewhere. Okay. So it builds up, builds up, builds up, builds up. So, okay, the body's like, oh no, something's going wrong. Okay, we need to send blood to that area. So they send blood, right? And then the clot keeps growing and growing and growing. If you use reason and logic. What is happening? If the blood clot is growing and the fresh supply of blood is not to that area or the surrounding tissue areas is not making it so the blood clot can break up and dissolve by chemicals or whatever, what's going on? It means your blood is toxic. It means you don't have fresh blood. Even if you're getting oxygen from the lungs, you don't have fresh blood because the nutrients in your body, because the heart goes to all the different areas of the body. It goes to the urinary system. It goes to the digestive system. So it gets the nutrients. It takes the nutrients from the digestive system and the urinary system. And and the blood is what it passes the nutrients that the rest of the systems of your body need to all the different systems of the body. So it's like they're all working together. That's what that's my understanding of things anyways. Like, I could be wrong. I need to go back and study anatomy and physiology, which I plan on doing after I get my continuing education credits done. But from my understanding, it would make common sense that the blood is what carries all the nutrients to the rest of areas of the body. And it takes nutrients from different areas and it gives the nutrients to the other areas of the body, including the lungs. And the lungs, have its own separate, kind of thing because you need, air to go, probably a large portion of air to go to the rest of the different areas of the body or whatever, or because the blood is doing so much work, I need oxygen to do my job effectively. So the lungs is I'm gonna be the main one to supply your nutrients of what you need so you can help the rest of the body out. So it's the cardiovascular, it seems like it's a heavy duty muscle, especially the heart, to be okay, keep pumping the blood, keep pumping the blood, keep pumping the blood through the whole body. You have to constantly do this. I need oxygen constantly. Keep giving me oxygen. Da 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 da. So it's you have the the lung system of the body and the cardiovascular system or the heart system of the body working together to make sure the whole body gets the nutrients. So anyways, that's my understanding of it. So if you just like mainstream medicine as your way for health and health solutions to different diseases that you may develop or your family develops, I give this video continuing education credit an A. You get an A because this goes over mainstream medical doctor terminology and stuff like that. If you are more into holistic health and you're wanting to find natural remedies to help cure diseases or help your body heal itself, whatever terminology you want to use, I would give this video an F because she did not go over how you could have a compromised immune system. You could have toxic blood where you're not getting any nutrients from any of the systems of your body, like the digestive system or the urinary system. And so when the blood is still circulating through the body, you develop a blood clot. And the blood clot doesn't break down because it doesn't have the proper nutrients to release the chemicals that break down the blood clots. She did not go over that as a possible reason of why you have a blood clot. So for a holistic medicine, this video would get an F. Now, I am a licensed massage therapist. I went into this profession because I wanted to do holistic medicine. I think for some cases, mainstream medicine can help some people out for certain circumstances. But when it comes to hardcore chronic diseases where you need nutrients in your body, proper nutrients on a cellular level, to me, you should go see a naturopathic doctor. And who maybe some are more better, maybe some are better than others. I do not know. But there are a bunch of naturopathic doctors that have released some of their information online. So feel free to check them all out and see what you think. But at the end of the day, remember, you have a brain. Use logic and reason and common sense to try to figure things out. Study anatomy and physiology for yourself. Read medical stuff for yourself. Does this make sense of why? I don't know, what am I trying to say? Sometimes people list diseases and then they're like, this is the solution to cure the disease. But if you read enough stuff and you tried to do things for your own health, you can begin to use logic, reason, and common sense to try to distinguish, will this actually work? Will it not work? So, again, I am just a licensed massage therapist. I am not diagnosing or treating you. I am just giving feedback on this video. Do you want medical, mainstream medicine? That's fine. Do you want naturopathic medicine, more holistic medicine? That's fine. The choice is yours. I'm not sure which is actually 100% effective because I'm finding natural stuff and mainstream medicine stuff, they're both not working for me in some avenues. So, what works for you? You have to determine what works for you. I cannot tell you what is going to work for you. I am just a licensed massage therapist, and my job is to massage people only. Use your own brain and figure it out for yourself. So, if you have any questions, feel free to put them in the comment section, or if you would like to share what you have found that works for you, feel free to do that yourself too in the comment section. If you liked this video, feel free to like and subscribe to this channel if you want. Until next time.